Again, thank you so much for this opportunity. So I'm very delighted to be here at the Closer Emerging Longitudinal Scholar webinar series on healthy aging. So in this very special occasion, I would like to share my recent study on obesity, psychological well-being related measures, and risks of 7 non-communicable diseases. Evidence from longitudinal studies of UK and US older adults. So at the moment, I work as a postdoctoral researcher at the Department of Psychology, University of Liverpool. And this study was conducted in collaboration with researchers across the UK, the US, and Ireland. A little bit about the background why we conducted this study, because as we know that obesity is one of the 21st century public health problem in which the prevalence of obesity is still high. And we know that obesity is associated with a range of negative health problems. And regarding to the prevalence of obesity in England, for example, the prevalence of obesity is high and almost double in the last 2 decades, from 15% to 28% in the last 20 years. Meanwhile, in the US, the prevalence is much higher, and it increased from 31% to more than 40% around the same period. And a lot of studies, including systematic review and meta-analysis, suggested that obesity is associated with a range of negative health problems, from cardiovascular diseases, diabetes, cancer, and etc. So that's why obesity and obesity health problems contributed a lot to annual healthcare expenditure in developed countries. For example, in the UK, around £6 billion of the NHS annual expenditure is attributable to obesity and obesity health problems. Meanwhile, in the US, based on the estimation which is conducted in 2019, obesity and obesity health problems contributed to 170 billion US dollars. So because we know that obesity is associated with a range of negative health problems and also contributed a lot to annual healthcare expenditure, understanding why obesity is associated with negative health problems become important, because we want to know about what possible pathway that might explain the association between obesity and negative health problems, so we can inform potential intervention and targeted policy to reduce obesity negative health problems in the future. And not only about physical health problem of the obesity, such as cardiovascular diseases, but also there is a strong evidence of the psychological burden of obesity. For example, in the recent review suggested that there are bidirectional associations between obesity and psychological well-being, but the most convincing findings from studies is that a greater body weight leads to psychological distress compared to the other way around. So that's why living with obesity is also associated with having negative psychological well-being. In our previous study that was published in BMC Medicine, here we conducted the analysis whether having obesity in the past might be associated with increased risks of early mortality in the future. And we also wanted to know whether psychological well-being can explain the association. So here in this study, we found interesting findings, such as having obesity in the past is associated with a range of current negative psychological outcomes, such as depressive symptoms, independently of current weight status. And then these negative psychological outcomes might explain why living with obesity in the past might increase the risk of early mortality in the future. And another example of our work, we tested the physiological dysregulation or physiological health as the outcome here, in which physiological dysregulation was defined by combining some biomarkers such as blood pressure, and then insulin resistance, and also the level of inflammation. And the higher score of physiological dysregulation indicated worse physiological health. And the findings suggested that even though there was a strong association between living with obesity and worse physiological health, but we did not find strong evidence of psychological well-being explaining the association. So based on our last two studies, we found inconsistent findings in terms of the role of psychological well-being in explaining the association between obesity and future physical health. So based on the recent evidence, we know that living with obesity is associated with a range of non-communicable diseases. But we still don't know the role of psychological well-being related measures in explaining the association. To what extent these psychological measures can explain why living with obesity is associated with a range of non-communicable diseases. So that's why in this study, we aim to understand the role of psychological well-being related measures in explaining why living with obesity is associated with increased risks of non-communicable diseases. So for this study, we use two longitudinal studies from the UK and the US. So we have study 1 and study 2. So for study 1, we use data from English longitudinal study of aging, ELSA. Meanwhile, for the US context, we use data from health and retirement study, HRS. So because in across study have different data collection methods, we use a different way. And for example, for US participant, because just only half participant participated in physical health assessment, and meanwhile another half participant participated or were involved in physical health assessment in the next wave. So that's why we combined half participant in each wave to be the baseline for this study. And in both studies, we included participants aged 50 years and above, and in each study, participants were followed up to 10 years period. And for obesity status, we for the main analysis, we compare obesity to normal weight because based on the previous evidence suggested that the association between obesity and increased risks of non-communicable diseases was stronger when we compare obesity to normal weight. And in each study, we have different numbers of psychological well-being related measures. For example, in the ELSA data, we use 7 psychological measures, and in US participant in HRS study, we included 15 psychological well-being related measures, and all psychological related measures were assessed at the baseline, the same wave when a weight status was fitted in the analysis. And because we wanted to know or to capture overall psychological well-being, we decided to combine some psychological well-being here into an index that we call as index of psychological distress. So the process was guided by exploratory factor analysis. And for the main analysis, we examine the role of index of psychological distress in explaining the association between obesity versus normal weight and increased risk of non-communicable diseases. Meanwhile, for individual psychological measures were tested as part of the supplementary or sensitivity analysis. And for the NCDs, across studies, we included 7 NCDs from hypertension, heart disease, stroke, diabetes, arthritis, cancer, and memory diseases. And all of them were mainly based on self-reported measures. Meanwhile, for some NCDs such as hypertension and diabetes, we also included assessment from biomarker data. And for memory disease such as Alzheimer and dementia, we also included a measure from using standardized questionnaire. And then I will walk you through how we did the analysis. First, we assessed the association between obesity and NCDs using Cox proportional hazard model because we have here a survival outcome. And then the same analysis was also used to understand or to examine the association between psychological measures and increased risks of NCDs. And for psychological measures, because all of them were in continuous form and we wanted to compare them across different metrics. So that's why we decided to convert all psychological measures into C-score. And for the analysis for each NCD, we excluded participants who developed that NCD before and up to baseline. So that's why for analyzing the association between obesity and an NCD, we only included participants who never developed that NCD. And then we also conducted cross-sectional analysis here to examine the association between obesity status and psychological well-being related measures using linear regression models. And then to assess how much the psychological well-being explain the association between obesity and NCD, we use causal mediation analysis with survival outcome. And in all analysis, we control sociodemographic characteristics. And we also conducted additional analysis here. So in both studies, instead of we analyze each NCD in separate regression models, we decided to estimate the association between obesity and cumulative NCDs using Poisson regression, and then we control for the number of NCDs at the baseline. And also because we have collaborators that have access to hospital episode statistic data, so that's why we were able to conduct sensitivity analysis using NCDs outcome that were obtained from hospital admission data for study 1 ELSA. And moving to the findings, so here the characteristic of participant in ELSA and HRS, and the characteristic of the participants seem to be similar across study in terms of age and sex, the proportion of females and males. Meanwhile, in the second study, RHS, we have here more participants from ethnic minority and also higher proportion of participants living with obesity. And also across all the NCDs here, in HRS study or in the second study, we had higher proportion of participants with all NCDs compared to UK participant. And this figure presenting the association between obesity compared to normal weight and increased risks of NCDs. So across 7 NCDs tested in each study, we found consistent finding in which living with obesity compared to normal weight is associated with increased risks of hypertension, heart disease, diabetes, and arthritis, because the confidence interval did not include one here. And then we also conducted a sensitivity analysis comparing different classes of obesity. And we found that consistent finding when we compare obesity class 2 and 3 to normal weight. Meanwhile, for the HRS data, we found a significant association in which people living with obesity class 2 and 3 compared to normal weight had higher risks for stroke in HRS study. And this is the findings of the main analysis in which we tested the association between index of psychological distress and increased risks of NCDs. And overall, we also found the same findings across studies in which in higher index of psychological distress, which indicated worse psychological well-being, is associated with increased risks of heart disease, stroke, arthritis, and memory disease. And even when we fitted individual psychological measure, we also found consistent finding for these NCDs. And then we also tested the cross-sectional association between obesity and psychological well-being related measure. So in the left table is for ELSA participant. Meanwhile, for the right one is for HRS participant, in which we found a stronger evidence of the association between obesity and psychological well-being when we compare class 2 and 3 obesity versus the normal weight, and less convincing evidence for the association between obesity and psychological well-being when we just only compare obesity to normal weight here. And we found consistent evidence for index of psychological distress, in which people living with obesity class 2 and 3 versus normal weight had higher score of index of psychological distress in ELSA and HRS. So because we found here different classes of obesity associated with psychological well-being and also increased risks of NCDs, particularly people living with obesity class 2 and 3. So that's why the findings here on the screen is from mediation analysis. We have two models here for ELSA and also HRS. So the table above for ELSA and the below for HRS participant. So we have two models here in which we compare obesity versus normal weight, and also the second model, people living with obesity class 2 and 3 versus normal weight. In both tables, we examine the role of index of psychological distress in explaining the association between obesity and the NCDs. So we just only tested the mediation analysis if we found evidence of the association between obesity and NCDs. So across both studies, we found no evidence of the mediation by psychological distress in explaining the association between obesity and also increased risks of NCDs. So we found consistent evidence across different NCDs and across what type of obesity we compare to normal weight. And also for the additional analysis, instead of fitting index of psychological distress in the mediation analysis, we also tested all individual psychological measures in each study, and we found consistent evidence, such as no mediation by individual psychological measures in explaining the association between obesity and increased risks of NCDs in both studies. And also, as I mentioned earlier, we also tested for the cumulative number of NCDs across 10 years follow-up by controlling the number of NCDs at the baseline. Even though we found the association between obesity and cumulative NCDs in both studies, but again, no mediation by index and individual psychological measures in explaining the association. And also for ELSA, because we had objective measures of NCD, we tested also the association between obesity and these objective measures of the outcomes, NCDs, and we found consistent evidence compared to the survey data in which people living with obesity had higher risks of hypertension, heart disease, and diabetes. But again, we found no evidence of mediation by index and individual psychological measures. So here, the main finding is no mediation by psychological well-being related measures, and it could be because biological mechanism might play a major role in explaining why living with obesity is associated with increased risks of NCDs. Because we know that there have been a lot of literature explaining a direct effect of adiposity is associated with metabolic syndrome and also might increase risks of physiological dysregulation, in which explaining why living with obesity might increase the risk of non-communicable diseases. And also in this study, we use sample of older adults, and I guess there is complex association between obesity and psychological well-being because older adults also experience unintentional weight loss, and to some extent, they might have worse psychological well-being even though they don't have obesity. So that's why psychological well-being might independently associated with increased risks of NCDs. So that's why more studies are needed to be conducted in this regard. So take-home message from this presentation is that we found a strong evidence of the association between obesity and a range of NCDs, but we found no evidence that psychological well-being or psychological burden of obesity can explain why living with obesity is associated with adverse health outcomes. And because we found no evidence of mediation by psychological well-being, obesity and psychological well-being related measures might independently increase risks of NCDs, because we also tested the association when we assessed the association between obesity and NCDs by controlling psychological measures, but the association remained. And also the same way when we tested the association between psychological well-being and increased risk of NCD by controlling obesity, the association also the same without controlling the obesity. So that's why obesity and psychological well-being related measures might independently increase risk of NCD. And that's my presentation. So if you need more information about the findings and also the analysis, you can have a look at our preprint. So I think that's my presentation. Thank you so much